Hello, my name is Trevor Taylor, and I am a second-year PT student at the University of Kentucky. And this is one way I've thrived in transition. Recently, I started my first full-time clinical. And let me tell you, going from months and months of online education to working with real patients in the acute care setting, it's been intimidating, to say the least. Fortunately, I've discovered a few simple strategies that's made this transition not only easier, but also more enjoyable. My first strategy is being aware of how you are communicating. As we prepared for clinicals, we were told about being professional, about being considerate, about being concise. And those are all important. But I want to remind you about some ways we communicate that are often overlooked. And they've really come to the forefront in this era of telecommunication. For instance, your face, it tells a lot. It can tell people exactly what you're thinking when you don't really intend to. It can show others how enthusiastic you are to be there and work with them. So please be aware of your facial expressions. Next, use active feedback, especially with patients and your clinical instructor. It's okay to summarize what they said. Let everyone know that you're listening, that you find their words important, that everyone is on the same page. And lastly, try to be engaging. Try to be like that professor that motivated you, that made you excited to be there. Try to phrase things in a way that's easier to understand, easier to retain, and try to make everyone that you talk to feel important. My second strategy involves adapting with a positive approach. These last few months, they've been difficult for everyone. And it's okay to empathize with other people's hardships, but try not to focus too much on all the negative and all the obstacles. Instead, I encourage you to talk about how you've grown, how you've rise to the challenge, and how you've improved. I'm not saying you have to be rainbows and butterflies all the time, but remember, being a bit more optimistic is more endearing than a constant retelling of how terrible everything has been. My last strategy is perhaps the simplest and I think the most important. I encourage you to think about all the things that made you become a physical therapist. I want you to reignite your passion. Tap into all those feelings and emotions that made you start this journey. I am excited for the opportunity to work with these people. I am excited to help them. If you have that mindset, it gives an energy to your actions, an energy that other people can feel and recognize, and an energy that will help you learn and grow.
Hello, my name is Beth Quinn. I'm the Director of Clinical Education at Bellarmine University in Louisville, Kentucky. And this is one way that I've thrived in transition. I've made it a point to intentionally frame my perspective on how this past year has impacted me. Everyone has had a hard year. Online learning has been hard. Online teaching has been even harder. Getting students into clinics during a pandemic has been hard. And there have been so many things that have not been fair. Clinics canceling because they had staffing changes, hospitals canceling because of COVID protocol. It hasn't been fair. But I can choose what I'm going to dwell on. Am I going to dwell on the things that I haven't been able to control? To dwell on things that we've had to face unprecedented challenges and how hard it feels, or how I'm going to choose to focus on things that we've learned. I've been able to connect with clinicians all over the US because now we hop on Zoom without blinking an eye. I've been able to access new online resources for my students that are just incredible tools. And just last week, I got to celebrate the most amazing graduation with our class of 2021 because despite all odds, in a much different clinical placement program than originally assigned, they finished their years of PT school on time, and that was amazing. So as you transition into your clinical experiences, I challenge you to spend some time thinking about how you're going to frame this past year of the pandemic. Students had very atypical learning experiences on campus and at home during COVID. So now it's your time to embrace every learning opportunity in the clinic. So set your intentions, choose your attitude, and good luck as you move forward.
Hello, my name's Andrea Maynard, and I'm a clinical instructor / supervisor of rehabilitation services at St. Joseph Hospital, Maine in Lexington, Kentucky. And this is how I thrive. My passion is working with students and encouraging them along their acute care journey. Even if acute care is not your passion, by the end of the rotation, my goal is for you to have a better understanding of physical therapy's role with the critically ill patient and to expand your knowledge base and skills. One way I help my students thrive is setting clear expectations in the beginning. We email back and forth before the rotation begins. I send out a packet about the facility that covers our policies, procedures, dress code, parking, lunch, and hospital hours, meaning you may have to come in early to chart review if it takes you a little longer. And we may stay late some days to round if the day was extremely busy with patient care and we still have things to discuss. We set weekly goals and have a Friday one-on-one session to wrap up the week with what we saw, how you progressed, and what are items that could be improved upon. The students always participate in goal setting because this is your rotation and your learning opportunity. What do you feel are your weak areas? How can I help you reach your goal? This also lets the students have control over their learning style. Also, thriving means open communication. Open communication with your CI, no matter how long you're there. Be open in the beginning. The more you communicate with your CI, the more they know where you are in your learning, how much assistance you may need or not need. Maybe I'm hovering too much, but what do I need to coach you on? I even have homework sheets I send home that's not meant to be torture, but to help you on your own time to read through terminology that's important. And we will see more of a certain diagnosis, procedure, line and tubes the following week as we move to a different unit. And it gives the students a chance to prepare for that, letting the students familiarize themselves with the change week to week as we rotate through the hospital. Gives you more control. Again, setting clear expectations week to week. Time flies, we're finished with the rotation, the blink of an eye, and students will even say, well, that was fast, and it is. But just being excited about being in the clinic and engaging with patients, bringing positivity. Also, thriving in the clinic to me is turning your frustrations into opportunities. Do you feel frustrated about several classes being on Zoom and less interaction with your classmates and faculty? Well, here's a chance to practice. I want to know what you know, but I'm also here to teach and guide you. Even though you may have fears about being here, treating patients, donning and doffing PPE, and what order do you do what in, we'll walk through all of that, and you get to practice. I'm here to help you fill some of these gaps you may feel you have. I have a passion for teaching and acute care, and it blends really well together. I don't like wallflowers. I don't let students just stand back and observe the first week. I throw you in pretty quickly. But again, I'm there. If you forget something during your history on your initial examination, I'll jump in and say, do you have stairs to enter your house? Is there a handrail? What side is the handrail when going up? Just to finish out all the questions that you needed without throwing the student under the bus, but letting you know we missed this, so we need to do it next time. This could be setting a goal for yourself next week, but being open and honest with your CI about what fears or concerns you have and where you hope to be by the end of the rotation, participating and setting your own goals, and taking an active part in your learning. We are thriving in acute care. We will continue to thrive, and we will help you thrive as well.
Hello, my name is Kristen Luttrell, and I am a clinical instructor and site coordinator at Massanicoma Louisville in Kentucky. And this is one way I've thrived in transition. This past year has been a roller coaster. This unfamiliar, ever-changing roller coaster has challenged all of us in ways we did not expect. We have all had our own different experience on this ride, but I think many of us can reflect back over the last year and pull some positive moments and situations. For me, those positive moments were knowing through strong communication, my team would be able to continue to provide the best level of care during a very uncertain time. As many students look forward to the start of their clinical rotation, we want to make sure the transition is as smooth as possible. Communication starts with the student, the school, and the clinical site coordinator. As we transition away from virtual learning to in-person learning, communication is vital to the success of everyone involved. We can thrive during this transition with a few key implementations. First, we want to be open and honest. Discussions on how the academic programs have prepared their students, followed by where the clinical side can engage and allow for further practice of these skills learned academically. Second, communication often, no matter how small the detail. Open and intentional communication between the site coordinator and the director of clinical education will foster the successful transition of the student into that clinical environment. Third, understand your value. As a site coordinator, I need to understand the positive value I bring to this team. It starts with preparing the student for my clinical site. This can include covering policies, procedures, expectations related to COVID-19, along with basic daily operations. As a site coordinator, balancing the need of the clinic, the school, and the student are critical. So as we begin to see the ride coming to an end, let's make sure the transition to clinics is an exciting and new beginning with strong communication as the foundation.
Hi, my name is Lauren Petterson, and I'm a third-year GPT PhD student at the University of Central Arkansas. And this is one way that I have thrived in transition: vulnerability, both with myself and with those around me in my program and at my clinical sites. So as students, I think we often feel like we need to go into clinical experiences to kind of prove ourselves, right? Validate the last few years of our lives that we've spent learning about the body and how we move and all of the nuances of PT. So don't get me wrong, it's good to be prepared to contribute, right? And have a say in the patient care when you're in the clinic, and definitely have an open mind to learn. But the ability to step back and recognize aspects that you can focus on and then communicate those with your CI will bring much greater benefit to you during your clinical experience, and it will also likely be a lot more enjoyable. Specifically, I think at this time, coming out of the transitions we've all had from online learning to maybe back to in-person learning to now going face-to-face for your clinical rotation, you might feel like there's hands-on skills or certain aspects of learning that you didn't get to fully experience. And that's totally okay, right? Totally okay to feel that way. And this is where you then step out of your comfort zone in your little shell that we have as students and let your CI know where you are. If you're uncomfortable with your CI, then that's fine, right? Reach out to a professor that you already have a relationship built with at your program on ways to work on your areas of concern. And finally, and I think most importantly, is to be honest and have that vulnerability with yourself. So take the initiative to reflect on your concerns, right? Put the ego aside. As PT students, a lot of us are high achieving, right? We're very proud. So put the ego aside, reflect on your concerns prior to returning to the clinic, and then be proactive about them, right? You don't have to wait for your CI or for your professor. You can go ahead and study a little extra prior to the clinic or at night when you get home and you're like, man, I really didn't know what to do, which is a pretty normal feeling, right? So do that extra little studying. Get together with a classmate or your roommate or your parents or whatever you used while we were all learning online for lab, right? A stuffed animal, whatever you use, and practice those handholds in manual therapy. Or if it's unrelated to PT, right? Simply acknowledging any uncertainties you have about entering the clinic. So this can look like a lot of different things for a lot of people, but having that recognition, understanding where you're at in your headspace, being vulnerable with yourself, and then communicating that with those around you will really help with those uncertainties. So like I said, the reflection can be difficult in having that open conversation, but it really will set you up to gain the most out of your clinical experience, even though it might be a little bit uncertain. But best of luck. You'll be great. Enjoy the clinic. It's a wonderful time.